I had seen another orthopod in town. I had gone to a sports medicine doctor, and and over a year's period of time I had a total of 4 injections in my knees. That felt better for a week or so, and then it was just back to normal. And it was so I could hardly walk without pain. And so I went in with Dr. Altenberg. He looked at the scope videos. He went through the history in detail. He did x-rays, and he said, you know, I think that the just doing mini knee replacement surgery is going to really help you, because the cruciates, the big ligaments in there, are still good, and your cartilage and the support system on the outside of the knees are perfect. Patella's good. So he recommended this. He said we can do both knees at the same time, probably, because it's less, it's not the great big time total knee surgery. You can probably ski this winter, which I love to do, and in 2 months we'll have you back on your horse, depending on what kind of horse it is. And he said also stay off the moguls when you ski. And I said I can do that because I really don't ski that well anyway. And so looking at the x-rays and going over my whole history and everything and examining my knees, he said, I think that this is the surgery for you. He said I did a number of them in my fellowship because he's the only doctor outside of Boise and Salt Lake that has spent extra time specializing in joint replacement. And when I found that out, I thought, this guy probably knows what he's doing. And so he recommended this, and I decided to stay in town and go to the hospital where I practiced for 30 years and see if we couldn't get them done and fixed. And so surgery was the first part of September. I spent 2 days in the hospital, actually one night, and I was up walking the halls. Well, I walked a little bit the day of surgery. I walked the hall 3 or 4 times the next morning. So I got home the next day and life was good. Physical therapy came, the home nurse came, and I did my exercises because I wasn't working, I was retired, so I could spend the time and do exactly what I was told, which my wife says is unusual for me. But I got range of motion, and then I did 6 outpatient physical therapy sessions. When I left those, I hurt more than I did when I went in, but it was good because I needed to get that range of motion. And so I rode a horse for about 15 minutes 3 weeks after surgery, because a friend of mine, a real cowboy, after he had a total knee, rode a horse at 3 weeks. I couldn't be outdone with him. And then I skied 7 times this year. Probably would have skied more had the snow been better, but it was not a good snow year. And then I've been training, and competitively already this year I've gone 110 miles at endurance rides, and ready to go this next weekend 160 miles over a 3-day period. And my knees are good. I'm probably out of shape, and I'm total body sore, but the knees are fine, which is just wonderful. And so to sum it up, Dr. Altenberg is very professional. He is very thorough. He knows his line of expertise, and I kind of get the impression that he does this to all of his patients, but he checked up on me about 3 or 4 times after surgery.